The first time I had a lupus flare, I wasn't exactly sure what was happening to me. I was visiting my family, and we spent a lot of time outdoors in the sun. And my head started to hurt, and I felt weak and tired, and my joints and muscles ached. I had a rash on my face, chest, and arms, and I also had sores in my mouth. My doctor later told me that I was experiencing a lupus flare, and that I must wear sunblock, and that there are many other potential triggers of lupus flares.
I noticed that when there is a lot of stress in my life, my flares are worse and last longer. 2 years after I was diagnosed with lupus, I lost my job and got really stressed out. Even though I had been stable for a while, a few days after losing my job, I couldn't get out of bed. My body hurt all over. My knees, feet, and hands were swollen, my hair started falling out, and I lost my appetite. Now I understand how important it is to try to control things that make me feel stressed, see my doctor regularly, and take my medication like the doctor told me.
Sometimes the immune system can attack itself and cause problems. This is what doctors often call a lupus flare. And the treatment here can be to increase or add medications to lessen the immune response. Next, keep in mind that medication, important as it may be in our treatment and management of lupus, can also have potential side effects. It is important you speak with your doctor and pharmacist to learn what side effects your medications may have and what to look out for. Since lupus is a disease that affects the immune system, and many patients with lupus are on medications that may lower the immune system, infections can occur. This can often feel or look like lupus activity. It is important you communicate with your doctor if your symptoms do not improve with treatment. Finally, remember that you can develop problems or medical conditions just like everyone else. Just because you have lupus doesn't mean you can't have other medical conditions that affect the way you feel. It's important to identify and write down all the things that make you feel poorly so that you know what you need to tell your doctor so he or she can determine whether you are sick or if you're having a lupus flare. Sometimes the issue is clear and can be resolved quickly. Other times, tests and follow-up visits may be needed. Either way, the information you give them will be critical. Lupus can be confusing. It can seem overwhelming because so many different things can affect how you feel. And unfortunately, there is no quick way to know what issue is causing certain symptoms. However, you are your best resource. Over time, you will learn to distinguish these issues. And again, it will be important to communicate what you have learned with your rheumatologist and your primary care or general physician.